ASUG TV 2018 Bhubaneswar. You are watching me live on MQR ASUG TV. I am glad to have with me the renowned IVF specialist Dr. Keshav Malhotra sir. Sir is the lab director for Rainbow IVF Centers. So welcome to the show, sir.
Thank you.
So sir, based on your recent talk in ASUG 2018 at Bhubaneswar, which was on single embryo transfer in India, so we'd like to hear from you why this single embryo transfer is so important and why there is a need of your views and opinions.
So, if you look at the current data in our country, like I was very privileged to actually formulate the NARI or actually calculate the data from the NARI database, and what we actually saw was that there are still clinics who are transferring 3 embryos, 4 embryos and 5 embryos into their patients. And the major problem when you transfer so many embryos is that there's a high risk of having multiple pregnancies. So twins, triplets, quadruplets, etc. It's a very high risk in IVF. And especially in our healthcare system where we still don't have enough NICU facilities in the country, transferring more embryos actually causes more problems for the patient. Like a lot of people think that when we transfer 3 embryos, we are giving the patient the best chance to have a pregnancy. But once the patient has actually sold their houses or actually given them for lease, and then they come for treatment, if you give them twins or triplets later on, they don't have the money to actually deal with those pregnancies. And that's why I think single embryo transfer is the need of the hour. We have all the technologies available to us to actually select the best embryo for transfer. Therefore, it's easily doable in our country, and I'm sure with this conference we'll take this message forward.
Yeah. So what are the technological advances are available to help to take this single embryo transfer to the next level?
So IVF, as you know, is a field which is rapidly advancing. So we have so many technologies which are now creeped up into IVF, right from sperm selection to egg selection, as well as embryo selection. But as far as embryo transfer is concerned, we only need the best embryo to transfer. So there's one technology which is known as time-lapse imaging, where we use a huge incubator which has cameras attached to it, and we actually track the whole development of the embryo. And therefore, if there is any disturbance in the morphological dynamics of the embryo, as in if the embryo is growing directly from 1 cell to 3 cell or 2 cell to 5 cell, etc., we can actually weed out those embryos and only transfer the ones which are growing normally. The second major technology which has come up in the favor of single embryo transfer is PGS. So PGS basically stands for pre-implantation genetic diagnosis. In this, what we do is we take out a few cells from the embryo, test for the genetics of that embryo. If it's euploid, then we transfer that embryo. If it's aneuploid, we can just throw it away. So these are the 2 major technological advances in favor of SET.
Okay. So sir, what are the problems with the multiple pregnancies?
So like I mentioned to you earlier, there is a lot of there's a huge lacunae behind as far as neonatal care is concerned in our country. So not many centers would have a proper NICU or a proper intensive care unit as well. And when you have multiple pregnancies, these women have a higher chance of having PIH, higher chance of having eclampsia, higher chance of having diabetes, hypertension, etc. So all the maternal complications which come up with pregnancy are actually double when you have a multiple pregnancy. And it's not only the maternal complications, we also talk about the neonatal complications or the neonatal morbidities. So these twins have a higher risk of having growth retardation. So there was a huge study by the Indian Association of Pediatricians, and they actually compared singletons and multiples. And what they found out was that there was a huge developmental delay as far as growth is concerned when you compared the children at 1 year as well as even at 4 years. So till 4 years, these children were still developmentally impaired, and that is one thing which we really can't offer to our patients when we have all the facilities to actually offer them a better modality. So the thing is that try and help the patients so as long as you don't cause them harm. And when we are transferring more embryos into the patients, I think we are causing them more harm than good. So that I think that's one key message that all the audiences should take from such a lecture.
Okay. So thank you very much, sir, for sharing your views on single embryo transfer in India. Thank you very much.
Thank you so much.